so I'm gonna start off. Anybody know what today is besides leap day and
February 29th?
February 29th?
Tuesday.
Sunday. It's 2012. It's still Jesse's birthday.
Is it your birthday?
Today is actually Rare Disease Day.
I don't have one.
That was funny right there.
Alright. The last day of every year in February. So February, the last day of every rewind. The last day in February every year is Rare Disease Day. And this is the day where we try to bring awareness to the different rare diseases that are in the world. Miss Hood, could you click on this link right here for me, please?
What kind of disease you got?
Et sans faire insouciance à deux anime, je sais qu'on est capable, tout est possible, tout est réalisable, on peut s'enfuir, bien plus haut que nos rêves, on peut partir, bien plus loin que nos chances, toi, plus moi, plus tous ceux qui le veulent, plus lui, plus elle, et tous ceux qui sont seuls, allez, venez, et entrez dans la danse, allez, venez, et entrez dans la danse.
Thank you. Alright, this was the official video for Rare Disease Day. And basically what this video is saying is we are rare, but together we are strong. So saying just because you have a rare disease does not mean you're alone. There are other people who are like you. You can go to the next slide. Now, are there any rare diseases that you guys know about? There are about over 6,000 of them.
6,000.
So we're going to start over here with Jesse. Go ahead.
Disease.
Okay. Keontae?
Skin disease.
Skin disease?
That's not rare disease, though.
Anyone else?
That is
across.
A rare disease.
Go ahead.
The one with the low white blood cell count.
Low white blood cell count. Okay. Anyone else?
Sickle cell? I was just going to say that.
Anyone else?
Oh, I thought sickle cell
Lupus
was
is a
rare.
rare disease.
Oh, I know what.
Hey, what is it when you come out but you can't say nothing to walk and you in your wheelchair? And that is, I don't know the name of it. No.
Artistic?
Yeah, I think that, and that
Artistic
yeah.
Well, for a disease to actually age across the line, but to be considered a rare disease, it has to have no cure. There's no cure for it. That's what makes these diseases rare.
So can the common cold be considered as a rare disease? So can the common cold be considered as a rare disease?
No, not the common cold, because you can take some medicine for it.
That's why they call it common.
Dead.
We already said
She's the teacher, Devin.
Herpes.
Tuberculosis.
Be quiet.
most of these have cures, so. Okay, but we're going to be talking about particular type of rare diseases today, which Casey brought up one of them. He said lupus. And does anybody know what lupus is considered? What type of disease?
It's like cancer, but it's worse.
Cancer?
Hey, can I ask you a question?
Autoimmune. Next slide, please.
Miss, hold up. Can I ask you a question?
Save your questions to the end.
No, this is like a question with the disease part. It's like
all this is going to be about to say. Save your questions to the end.
I know, but it's kidney stone. This one.
Yeah, save them to the
Damn.
end.
Let me say something real quick, students. A while ago, when I said that I expect you to have your best foot forward and to show respect and I actually meant that. Okay, and I do expect that completely, because you are a wonderful group of young people, and I can tell that you are involved, but some of us are you can tell that some of us are kind of talking over each other. So this would be an assembly just like any other assembly where you save your questions until the end, but you don't blurt out, especially when the presenter is talking. Okay, you listen when the presenter is talking, and you don't blurt out. And this is just that's a skill that that we're going to work on right now. Okay, and that's what I expect, and that's what we're going to do. Okay, all right. Thank you so
autoimmune diseases. And autoimmune diseases are rare diseases. Now, does anyone know about autoimmune or what an autoimmune disease is? Anyone? You know. What did you say earlier?
Oh, it's like you can't actually cure it because you're kind of born with it. Like
no, but you said something about white blood cells.
Yeah, low white blood cells. Don't have
Well, this is what it is. Actually, with autoimmune diseases, you produce too many white blood cells, and your white blood cells starts to attack your body. So instead of when you get a cold and your white blood cells attack the virus that your cold has. Sorry, excuse me, Michael. So when you get a cold, your white blood cells fight off the cold. But in this case, people who have autoimmune disease, their body always thinks that it has a cold. And so it's always producing white blood cells, and your white blood cells will start to attack different parts of your body. Now, to give y'all an idea of what some autoimmune diseases are, because you've heard of them before, but a lot of times you don't know that they're actually autoimmune diseases. Has anybody ever heard of diabetes type 1?
Yes.
Oh, yeah.
That is an autoimmune disease. You're born with it. When you have type 1, you're born with diabetes. Okay? How about lupus? We said lupus earlier. Anybody heard of MS?
Mm-hmm. What does it stand for?
MS, multiple sclerosis. Another one is RA, or rheumatoid arthritis. Most of everyone has heard of arthritis.
You can smoke weed for that, right?
Nah, ain't it some like is arthritis or glaucoma or something like that?
Glaucoma. Crohn's disease, Graves, and to give you all a little info how common it actually is in people that you know, like there are some famous people who actually have autoimmune diseases that y'all have heard of. One would be Montel Williams, talk show host. Elizabeth Hasselbeck, she's on The View. Angie Stone, she's a singer. Nick Jonas, another singer. Tony Braxton, Trick Daddy.
Trick Daddy got what?
He has lupus. Venus Williams, she has, I think it's Sarnton. It's basically she has dry eyes and doesn't produce enough saliva and stuff like that. And Seal, and also Missy Elliott. They all have autoimmune disorders.
What Missy Elliott you say?
Yeah, Missy Elliott also has one also. She has Graves. She just found out a couple years ago that she actually had it. You know when she started losing all the weight? It wasn't because she was trying to lose weight, it actually she got sick and started to lose weight. Go ahead to the next slide for me, please. Now if you look at these people, they all have something in common. Can you see something similar?
And the red
left side of their face.
Now with these are two little girls. You can see with these two little girls, one side of their face seems like it's kind of paralyzed. And so this is what happens like the children.
But that's not funny, man.
With this side, okay?
That's not,
and then on
really
the
not
other
funny.
side, I don't know if you can tell, but if you look at each one of these people on that side, if you look at their mouth is kind of shaped the same. Like the lower part of their mouth is kind of shaped the same. It kind of seems like it's like their teeth are kind of too big for their mouth. Do you notice it?
It's like a doll.
All right, well, all these people have one thing in common. You can go to the next slide.
That's messed up.
What they have in common is something called Scleroderma. Okay?
Is that the cup?
Huh? Oh, I just picked the cup because I thought it was nice.
I just asked for real though. Like,
no, on the cup it says support Scleroderma awareness. Go to the next slide, please.
It says Scleroderma.
Can you click on that link for me?
I've been a registered nurse for 42 years, a mother to 7 sons. So when a mom calls the 24/7 nurse line at...
There we go.
Hi, I'm Bob Lahita, the Chairman of Medicine at Newark Beth Israel Medical Center and Professor of Medicine at University of Medicine and Dentistry of New Jersey. And I'm going to tell you about scleroderma. Scleroderma is a chronic connective tissue disease, which today is called an autoimmune disease. The symptoms that are characteristic of scleroderma are very clear. tightening of the skin for generalized scleroderma, which is called progressive systemic sclerosis. And the progressive systemic sclerosis means that the skin is tightened throughout, so that skin that's on the finger, for example, will be very, very hard to squeeze. There's sclerodactyly, which is a form of arthritis, which involves the hands, and the hands are contracted. Common to scleroderma are several things. Raynaud's phenomenon, which are basically discoloration of the fingers in the cold because of constriction of the blood vessels at the tips of the fingers. The hands turn red, white, and blue, and they can be very, very painful. This also occurs in the toes. It's difficulty swallowing. Food tends to get stuck, so patients that have scleroderma will find that they have to drink water in order to get food down. But sometimes even that doesn't work. And your doctor can evaluate the tube that goes into your stomach called the esophagus. Another sign of scleroderma would be a chronic cough or chronic shortness of breath because the tissue of the lung gets hard. It gets fibrotic in some patients. Going along with this theme of hardening of the tissues, which is the laying down of connective tissue or collagen, in the bowel there is malabsorption. So frequent diarrhea, for example, can also be a sign of scleroderma. And finally, hair loss, certain kinds of blood vessel changes in the face, tightening of the lips with what we call a narrow gape, or an inability to open your mouth wide to eat something like a hamburger or a hoagie sandwich. That is also a symptom of scleroderma. Now the question is, who gets scleroderma? Well, scleroderma can be found in both men and women, but women surely predominate with scleroderma, and women get scleroderma about 4 times more commonly than men. And I'm talking about women in the childbearing years. Now, children can get scleroderma as well, and they get unusual kinds of scleroderma, which can be localized to one extremity, for example, or be localized to the face with a so-called coupe de sabre abnormality, which is a fold in the face that is a result of tightening of the tissue. These are uncommon. The treatment for scleroderma is unfortunately very limited. Doctors generally give a small dose of corticosteroid to get rid of the edema in the affected extremities to allow you to move better and give you more comfort. There are trials that are going on right now, research trials involving chemotherapeutic agents like methotrexate, cyclophosphamide, Cellcept, and others. But unfortunately, there is really no successful therapy that reverses the course of this unfortunate disease. This disease is a serious illness, and if you have any or all of these symptoms, you should seek medical care. For more information, go to about.com.
Thank you. One thing I want to, he said that there is no cure, but for some people, they do go into remission, kind of like cancer goes to remission. Well, with scleroderma, some people, they go into remission, and it goes away for a period of time, but then it sometimes come back. And other people, it goes away and never comes back. All right, go ahead to the next slide. All right. Basically, just want to kind of summarize what he just said. Basically, he was just letting you know the scleroderma is a chronic illness, meaning, there's no cure for it. There's really have no idea where it comes from, how do people get it. Some people like to think that it's genetics, but there's no proof that you can get it through hereditary. Just about a little bit over 300,000 people today have scleroderma. And I believe it's actually more now because a lot of people are undocumented. They have it and don't even realize that they have it.
What's scleroderma?
Scleroderma?
We do it over.
Yeah,
no,
okay.
Oh my God. Clip
Right here, real tight. It's a chronic disease that affects the body by hardening connective tissue. So basically, your skin becomes hard. Your organs become
Every time
hard.
I like the tissues in the lung, when you was talking about,
the tissue.
I was only I was in and out, in and out, in and out.
Yeah. So basically, any type of tissue that you have in your body, it hardens. Okay, it tightens. And so, he was telling you on there, for a lot of people, it's hard for them to talk. They can't move. And later on, I'm going to actually show you pictures so you can have a visual view of what it looks like to have scleroderma. Let's see if anything else on here. Now, for each person, just because you have scleroderma doesn't mean it's going to be the same from person to person. So, if Casey has scleroderma, he might look completely different from Kendra. She has it. They can look completely different. But most times, you can see a similar, if someone says they have scleroderma, you look at them, you can kind of tell because they normally have, like I said, that mouth shape. And in kids, you see the fold of the face that the man talked about earlier. Go ahead to the next slide. All right, there are basically two main types of scleroderma. One is called localized scleroderma, and one is symptomatic scleroderma or symptomatic sclerosis. And it's one that I'm really going to focus on today, and it's one of the types of systematic sclerosis, which is limited scleroderma, which is also called Crest syndrome. And with Crest syndrome, it affects the skin of the face, the hands, the feet, and also affects the different types of organs within your body. Go ahead to the next one. Okay, here we go, Crest. The reason why it's called Crest is because when you spell out Crest, you get the 5 letters, and each letter represents something. And to be specific to have Crest, you have to have 3 of the 5. Okay? So with the first one, you will see that you will start getting calluses on your fingers, your hands. And basically what that is, it kind of looks like a wart. Like if you ever seen like a wart on someone, or like on their finger or something, it's kind of like a white, hardened.
It's hard to skin.
Yeah, it's basically that's what it is. And for some people, that skin breaks, and the white part, actually the liquid that's underneath it, it kind of moves it out. It's really disgusting type looking, but that's what it is. And people get it on their fingers, or they can get it on their elbows, their legs, anywhere where there's a bone, they can get it. And if it opens up, the liquid will kind of pour out, and so you have to keep it bandaged and stuff like that. And then you have the R, which equals Raynaud's phenom, and that's basically when your poor circulation to your feet and your hands. And so you will see people with their hands will be blue, red, or white. Some people turn purple, and it's basically showing they're cold. There's no blood circulation, no oxygen getting to it, and so their fingers and their toes get cold. And some people have to get their fingers or their toes cut off because it kind of turns green. Now with the esophagus, which is, the esophagus tube, basically you have acid reflux, heartburn. You have trouble swallowing food, keeping food down. And so that's basically with that. And then with this one is your fingers, the skin around your fingers gets real tight. And so your fingers kind of begin to go, bend like this. And sometimes your finger actually starts to deteriorate.
You get nubs?
Yes. So if you ever saw someone with nub fingers, they could have scleroderma.
I know, boy, you used to do that.
And then the last one, I have not seen this myself. I have not met anyone who actually have the red marks on their skin, but I have met people who have white marks. And so I've never seen it with the red marks, but I've seen it with the white marks. I've also seen it where people get brown marks on their skin, and basically their skin darkens. All right, what's the next? All right, here are some images of actually different ways you can see scleroderma. So here's the first one with the nubs. And you see their fingers. And then here's an example of when the doctor was talking about the mouth. They can't open their mouth.
They can't close it?
She can close it, but she can't open it. Right now, it doesn't open. This is not a wide mouth. This is very small.
You like this?
Yes. So like if she tried to eat a hamburger, it wouldn't work.
I mean, I'll be mad.
And right here is actually an x-ray of someone with scleroderma who the scleroderma has attacked their lungs. And he was talking about how you get fibrosis. And basically some people, it's like having glass in your lungs. That's how someone described it to me. And I was like, you have glass in your lungs. And so
every time you breathe, it's like you're like stinging your body or something?
It hurts. It's hard to breathe. You have chest pain, shortness of breath. It's like you have asthma to the 10th power.
Can you just cut that part off?
Here's another example of how I was saying how I haven't seen the red marks, but I've seen the darkening of the skin. And this is like looks like a person who has fair skin, and their skin has darkened. Now down here is a person who, you can see their scleroderma got pretty bad because they kind of look like they're kind of bent like this. And what happens is your body starts to, you become like an old person. You're not an old person hunched over, and and they can't move. Well, that's kind of what happened to this person right here.
Aren't they popping back?
Bullet hand.
Can you skip it?
Go ahead to the next slide.
Skip it?
Now, right here is a young lady who has scleroderma, and this is a before and after. You see her before. Nice, pretty girl. Healthy, but after she got sick with scleroderma, she got very skinny. You see around her eyes is dark from being tired. She's very fatigued. If you look at her mouth, her teeth look like they've grown like really big. But it's just basically.
Doing her teeth? I thought doing with both sets.
Huh?
Doing both sets of her teeth?
Yeah, this is the top and the bottom. But unlike this one, you see when she smiled before, it was, small amount of teeth shown. But before, her mouth can't cover her whole entire teeth now because it's gotten so tight. Her lips can't cover her teeth. Because although, the scleroderma is shrinking your skin and your face, it doesn't make your teeth smaller. So, I'll get to you in a second, okay? So with her, you can see how much she's changed. And I've actually talked to the girl, and she gets happy if she gains like 1 pound because it's hard for her to gain weight.
You talked to her?
Mm-hmm.
What's the age difference? Is the age the same or good years?
I'm not sure. I know she's still young, so this is the picture over there is recently.
How old is she?
And so she's in her 20s. And so this is a young girl, and
what causes this stuff?
What causes it? We don't know the cause.
Yeah, transmittable?
Go ahead to the next slide. Alright. I wouldn't feel right, me being a teacher, if I didn't have an EQ question.
Oh, here we go.
It is a simple EQ question. Basically, what is scleroderma?
You just told us.
I know, tell me. I want to make sure you
A disease.
Bad
taste. Talking about disease, Casey.
Type of disease a woman can have it when she's pregnant with babies. Anybody, Casey.
A woman is more likely to get it.
4 times
more likely to get it.
And it's actually the harm. It's when someone face maybe their hands or skin will change.
Alright, so you're talking about the symptoms, the different symptoms. So you're talking about the folding of the face and the arthritis in the hands. Go ahead, Jesse.
Classified by crest.
Classified by crest. That's the one we talked about today. Was crest. Yes, sir.
Autoimmune disease.
Autoimmune disease. Anyone else?
It's basically the tightening of the skin.
Hardening of the tissue. Yes, sir.
A rare disease.
It's a rare disease.
Growth of teeth.
You said what?
Growth of teeth.
No, the teeth don't grow. What happens is the skin shrinks. And so if the skin's shrinking, the teeth just seem like they've gotten bigger.
Do it mess with your growth, like your
face tightening?
Yeah, that's a good question. Matter of fact, click to the next one. Any questions? Good question. Does it mess with your growth? Yes. When a child gets it, sometimes it's like one side of their body doesn't grow normal. And I have seen pictures of girls, teenage girls, where one leg is bigger than the other one. Extremely, you can tell the difference.
Yeah.
Oh, I know somebody with that. It was a bus driver in middle school. His leg was small on this side, but this side it was muscular. His arm, like on this side, was smaller too, and he used to like.
I know a dude named William when I was younger. Will actually, and his whole hand looked like a baby's arm, and the other one's like a regular size.
Well, he could. I don't know if he had scleroderma, but I mean, he could have had something else wrong from it. Any more questions? Yes.
Let's say like the very, very next day I get this. Can it kill me?
You can die from scleroderma if you go untreated. Just like any rare disease, since there's no cure for it, there are chances that you will die. But if you get treated for it, you can prolong your life.
So, like, do they give you like antibiotics? Do you
Well, on the video, one of the treatments was he said steroids. Another one, not the kind of steroids that you're thinking about. These are steroids given by the doctor. Chemotherapy. And then they have other different types of herbs that people are trying. They have different research teams and.
But I thought chemotherapy was only for like cancer.
Well, this is the reason why you use chemotherapy, because chemotherapy actually suppresses the immune system. And so, since when you have an autoimmune disorder, you produce too many white blood cells. This way, it lowers your white blood cell count. So you also can get sick, you get a cold or something like that because you don't have a lot of white blood cells also. So they also recommend that you get a flu shot so you don't catch a COVID. Let me go over here because he had his hand up first. Go ahead.
Is any of this transmittable?
No, it's not contagious. It is not contagious. You can't catch it from anybody. Go ahead.
Like, is it like really painful?
Yes.
Yes.
For some people, they get rheumatoid arthritis, and basically what that is, just like your grandparents get arthritis, and they be like, oh my back, or my shoulder, they be in pain. Well, take that and times it by 100.
Dang. I ain't talking. I'm talking about like that lung thing, like. Can you stop breathing from that?
Like, okay, have you ever met anyone with asthma?
Yeah, I got asthma.
Okay, then you know the feeling when you have an asthma attack.
It don't. Yeah, when I used to have asthma attacks when I was younger, but it don't act up no more like that. But I'm talking about that one thing when you said the glass and stuff.
Yeah, it's just hard. Makes it harder for you to breathe, and some people have to walk around for oxygen tank. Anyone else?
I hope it don't hurt when you breathe.
I mean, it does because you just think about it, your shortness of breath, so you're working extra hard to breathe. Anyone else? Staff, y'all have any questions? All right, next slide.
We being more involved in this.
Oh, these are slides. Okay, All right.